So I am a pediatric surgeon and I'm working in Graz, in pediatric surgery clinic in Graz. We are dealing with vascular malformation in a multidisciplinary setting, and pediatric surgery is part of this multidisciplinary group working for these patients for these conditions. Some vascular anomalies appears during the prenatal life, and also in this time we do consultation for families of these patients, but also for patients where the vascular malformation appears in the next years during the childhood, come to us to have an appropriate diagnosis. Well, surgery is actually just one part of our job with these patients, because I think the most important part is to give these families and these patients a right diagnosis, and in this sense, pediatric surgeon works in a multidisciplinary setting in order to formulate the correct diagnosis. Surgery then is a part of the treatment that follow the correct diagnosis. And of course, for some patients, we can have a surgical solution, like in case of localized vascular malformation that could be removed surgically, or also in case of vascular malformation that cause pain or limitation in function. In this case, we can help patients. An example could be huge lymphatic malformations of the tongue, where a surgeon, we can in some case remove part of a tongue and restore a little bit function. Yes, it is something that I mean, it is a nightmare for each doctor to make a wrong diagnosis in this sense. And the risk on focusing on this malformation or this condition is to focus just on vascular anomalies and to oversee that other condition exists. And there is unfortunately cases of patients who has diagnosis of vascular malformation, and at the end they had a tumor, a malignant tumor. As doctor, sometimes we focus on our specialty. Surgeon think maybe we have to cut off everything, or dermatologists we can treat everything with a drug or laser. It is important to find a balance between all kinds of specialties and to have a real discussion about the cases in order to find the better solution for patients. Well, there are many technical improvements that nowadays are ameliorating the situation of surgery in general. I think that one of the most important steps we are living now is the development of the artificial intelligence that could help in make the correct diagnosis and drive a better way to do procedures. I mean, in the future, it will be one of the most important parts of the diagnosis that helps the experience of doctors in order to formulate the correct diagnosis.